said, my name is Stephanie Ramirez. I'm a speech language pathologist here at North Kansas City Hospital, and I primarily work in the outpatient setting. But I am also a community educator for the Alzheimer's Association, and I do a lot of training and education for them as well. So we will get started. Talking about this cause, I feel like all of us are here, for one reason or another. And with the prevalence of Alzheimer's in today's, day and age, I think everyone has been touched by the disease. I myself had both of my paternal grandparents pass away last year with the disease, and I will be sharing a little bit of their story with you. I think it's important to note that no two people experience the symptoms or the disease the same way. But if you can, take a little bit of, firsthand experience and combine that with your own knowledge, it can be very beneficial. So I will be sharing a little bit of their story. For today, I want to begin by talking about what is Alzheimer's and what is dementia. And then we will get into what the warning signs are and what recommendations I have for what to do next if you feel like you or a loved one is experiencing those changes. And then, like I said, we'll have time for questions and kind of a review at the end today. So Alzheimer's and dementia are often used interchangeably, but they are different. So dementia is the umbrella term. It's the general term for loss of memory, language, problem solving, other thinking abilities that are severe enough to interfere with daily life. That's the definition of dementia. Alzheimer's disease is just one kind of dementia, and it is the most common type of dementia. It accounts for about 50 to 75% of dementia diagnoses. Down there in the little graphic, you can see there's also vascular dementia, frontotemporal dementia, Lewy body dementia, to just name a few. So there are different kinds of dementia, and that is, again, part of the reason why early detection and testing is important, so you know what you're actually dealing with. So just a couple of graphics here. You can see on the left, Alzheimer's, again, is 50 to 75% of the diagnoses of dementia. And I think that it's important to know that it's not just memory. Typically, when we think of Alzheimer's and dementia, the one thing we all think about is bad memory. But it's really much more than that. It is perception, reasoning, attention, judgment, language. So there are a lot of different symptoms, a lot of different areas that can be affected, not just memory. And like I said, I think in this day and age, everyone is affected in some form or another. And worldwide, about 50 million people right now are living with dementia. And an estimated 5.8 million Americans age 65 and older are living with dementia this year. Alzheimer's is currently the 6th leading cause of death in the United States. And they estimate that the lifetime care cost for one person who contracts the disease is going to be $350,174. And that does not take into account unpaid caregiving, which is a huge component of the disease. Medicare and Medicaid paid out over $195 billion in 2019. And by 2050, over 13.8 million people are expected in the United States to have Alzheimer's and dementia. So it's no wonder that Edward Jones and AgeWave did a study recently and found that retirees' biggest fear is Alzheimer's and dementia later in life, 32%. And that's above cancer, COVID-19, stroke, heart attack. Alzheimer's and dementia is number one. So I want to quickly point out some normal age-related changes, because I think that it is easy, especially if you're anxious about getting the disease, you have a family member with the disease, that you might start to like read into certain things happening and say, oh my gosh, I have dementia. But that might not necessarily be the case. So it is very important that you talk to your doctor and discuss these things, because some of it might be normal and some of it might be having to do with something other condition. It is perfectly normal to forget what day it is. I think being in quarantine for part of this year, that was very common for a lot of people, but most of the time you can remember later, what year it is, what month we're in. Losing things occasionally, I think, is very normal, but most people are able to retrace your steps and find what it was that you're looking for. Sometimes forgetting what word to use or feeling like a word is on the tip of your tongue is very common and completely normal. Missing a monthly payment once in a while or making a bad decision once in a while, we all do that. Slower processing speed, I think that can be contributed to just normal aging oftentimes. And same thing with difficulty multitasking. Your brain is just like any other muscle in your body. You have to exercise it to keep it sharp. And there is a certain amount of change that can be expected as we age. I recently gave a talk on healthy aging to help slow those things down. So if you're interested, I believe you can find that on YouTube as well. So let's get into the warning signs. And I think that it is important, while, it does bring about difficult feelings and anticipation, anxiety, it is important to acknowledge if these things are happening, not ignoring them or just saying, oh, that's just aging. If there is any concern whatsoever, it's a good idea to be very proactive rather than reactive. And so talking to your doctor, again, is going to be really important. But I'm going to outline 10 warning signs here. And like I said, I think that it is important to hear stories from other people. And I'd just like to share with you, these are my grandparents, and that's me in the middle. My grandfather on the right, Ray, was an avid farmer. He loved Minneapolis Moline tractors. He loved the Boy Scouts. He was very active. And my grandmother, Barb, on the left, loved Scotties and gardening and playing bridge with her friends. They were both very active in the Methodist Church. And both of them, unfortunately, like I said, passed away last year. But I think that we can all learn from their story. And so I'm going to be sharing some of the signs and along with what we experienced in my family personally. So number one warning sign is memory loss that disrupts daily life. So this is more than just forgetting what day it is and then remembering later. It is forgetting events or conversations completely, needing frequent reminders for routine events or information, things that you do every day, repeating the same information, the same questions again and again. That is, obviously affecting and disrupting your daily life. So with my grandmother, she started by kind of forgetting conversations, information that we had told her, that progressed to forgetting the names of her great-grandchildren, and then kind of working its way up. When I brought my son over to see her, a lot of times she would just call him the little guy because she couldn't remember that his name was Owen. And, in the beginning, I would kind of explain to her, this is my son, his name's Owen. And later on, she would forget that and ask if, if his mom was okay that I had him. She didn't remember that he was my son. And, in her eyes, being her grandchild, I wasn't old enough to have children. So it made sense in her mind that he must have belonged to someone else. And typically it's the newer information that they'll forget first. So it makes sense that her youngest great-grandchild would be what she forgot first. And then, you know, she could remember who her children were, you know, pretty much throughout the disease process. But it's the newer information, the short-term memory is typically what's affected, whereas the long-term memory, memories from childhood are typically still there. I don't know if anyone has seen it, but there's a video clip that's been circulating of a lady in a nursing home who used to be a ballerina, and they play her the song from Swan Lake, and she can still do all of the beautiful arm movements from her dance. And so it's just that long-term memory, and that is still preserved even throughout the Alzheimer's disease process. So it's pretty remarkable. Okay, second warning sign that I think everyone should be on the lookout for is challenges in planning or solving problems. So that kind of comes along with the judgment. Executive function is kind of what we call that, higher level thinking, planning, problem solving, decision making. So you might notice that they're having trouble paying their bills, trouble following a recipe, trouble keeping track of their appointments or their medication. Maybe while watching TV, they, you know, just kind of stop paying attention because they can't follow the storyline, or maybe they have difficulty focusing on the story itself or the television itself. They lose focus and kind of get distracted easily. So my dad's youngest sister actually noticed that a lot of the bills were not getting paid for the farms that my grandfather always did. My dad and my grandfather would always sit down together to kind of go over everything during tax season, and my grandpa just had all kinds of receipts like haphazardly strewn about the house in, you know, a drawer here and a canister there, and, you know, no sort of organization. So my dad took over and helped him with a lot of the farming, and my aunt helped with, you know, the day-to-day bills, and helped with cooking and just making sure that they had good nutrition, because they were basically reverting to just eating microwave meals because they were having trouble with, you know, cooking a more, you know, complicated dish. My grandmother was active reader. She was in a couple book clubs, and she basically stopped reading because, again, it was difficult to focus on the story. So she kind of stopped participating in that as well. Our third warning sign is difficulty completing familiar tasks. So this is similar to number 2, but you might notice difficulty with driving, difficulty using the phone, difficulty going grocery shopping, difficulty with household chores. Maybe you're noticing that your grandmother or your mother, who was once very tidy and kept very clean house, you've started to notice dishes piling up and laundry not being completed. You might notice that they're having trouble managing their medications. That's another big one. And actually that's, I think, the most dangerous one, because you don't want them to take more of what they need, forgetting that they have taken it already. And certainly you don't want them skipping medications because that, you know, they're prescribed for a reason. So that's actually what we found, that my grandparents were just not taking the medicine at all. And so my aunt, again, kind of took over with that and started to help, and helped get, you know, kidneys back functioning properly and hearts functioning properly, because those medicines are important. Also, you know, my grandmother, again, was very tidy, and then we started to notice that things were getting a little bit messy. And we actually found a popcorn maker that she had put in the closet that still had popcorn in it, and it actually had attracted some mice, which was really unfortunate. And my aunt was an angel and fixed that for us and got it figured out. But that would have never been something that she would have done before. Also, when she was cleaning the carpet, she used bleach instead of a regular cleaner. So there was a large bleach spot on the carpet that, you know, again, she just didn't remember what cleaner needed to be used for that particular issue. So those familiar tasks. Next, we have confusion with time or place. It's very easy for people with Alzheimer's to lose track of dates, years, completely. Lose track of when something happened in time. Getting lost on a familiar route in the car or while walking is very common. You know, my grandmother used to go get her hair done, and they lived in a very small town, but she used to go get her hair done, and one time she went and she couldn't find the place where she always got her hair done. And that was a place that she had been to pretty frequently throughout the years. You know, and losing track of when something happened. So I think she would think that my mother was still my dad's girlfriend. So forgetting that they were actually married, or, you know, oh, you remember I graduated from college, so now I'm working and doing these things. So just kind of keeping track in time. One of the, you know, just little side tips that I think, because obviously this can be quite distressing for someone if they realize that it's happening, but they still just can't remember. Number one, I think keeping a calendar very visible all the time, that they can look at every day and updating it. That's something that we did with my grandparents that was really effective. We also had a notebook on the counter that my aunt would write just a tiny little blurb of what they did that day. So then they could look back and say, oh yeah, I went to the doctor on Tuesday and then, you know, did this on Wednesday. So it's kind of creating those memories there. And later on in the disease process, I think it's important to kind of meet them where they're at. So if they're not thinking that they're in today or this year, if they're, you know, back in 1958 and, you know, that is real for them, it can be quite distressing to hear that that's not the case over and over again. So one of the suggestions that I have is just, you know, especially later in the disease process, meet them where they are, and just go from there instead of, you know, correcting or, you know, talking down. Just, you know, gently redirecting them is definitely the way to go. All right, number 5. So another red flag would be trouble understanding visual images and spatial relationships. So you might notice a new difficulty with balance where they really never had any issue before. You might notice tripping over things or even falls and spilling things, just, you know, a general clumsiness that you maybe did not notice before, difficulty with depth perception. My grandfather, unfortunately, backed into a light pole because he didn't realize it was as close as it was. Thankfully, only his truck was damaged. My grandmother did actually have a fall in the kitchen. And again, she walked the dog every day, she gardened, so that was pretty unusual for her. And so again, kind of some red flags. You would definitely want to go into the doctor and see, you know, what's going on. Is it a visual problem? Is it a balance kind of vestibular problem, or is it something more? Number 6, new problems with words or in speaking or in writing. So typically, even with age-related memory changes, your vocabulary, your reading ability, aside from the visual component, will not be changed. You have that kind of ability, and it sticks with you. People with Alzheimer's or maybe developing Alzheimer's, you might notice that they have difficulty participating in conversations. They might get really quiet or have common issues with forgetting words, common words, names that you know that they knew before. Difficulty following verbal directions, and difficulty with writing. So maybe not writing letters anymore or having trouble writing a check properly. You might notice that. My grandmother would often write letters when she was younger. Every Christmas, she would write a giant poem that told everybody what we had been doing, and it was all rhyming. And she just couldn't do that anymore. My aunt helped her, but I know that was something that she really loved. And, you know, she's very social. So when she forgot a word or a name or a person, she was very frustrated by it. And she would always tell us that she was stupid. And we would say, no, you're not stupid. And that's the thing. I think, you know, their intellect and who they are as a person is not changing. It's their ability to access the information that's changing. And so, you know, it's very important, even in the later stages, that you don't talk to them like they're children, that you use age-appropriate language, and that, you know, you are respectful, because they are definitely, you know, the same person on the inside. You know, simplifying things certainly can help with frustration. So maybe just giving a one-step direction instead of a three-step direction can help. And then obviously, again, helping with some of those more complicated writing tasks can be good. All right, number 7, misplacing things frequently. And again, I did say that it's very normal to lose things, but in this case, you might find that the person is losing things by putting it in a very odd or inconsistent location. So when you lose a remote control, you might lose it in the couch cushions, or you might have it fell on the floor off the coffee table. My grandmother put the remote in the refrigerator, and I know it's probably, she went over to get an iced tea and brought it with her and set it down and then forgot it was there. And they actually didn't find it for a while. So that was very frustrating. Also, you know, you lose the ability to retrace your steps. So you're trying, you know, to go back and think, okay, where did I last see that object? But it's just not there. So I think that, again, it is normal to lose things, but most of the time you should be able to find it again, you know, even if it's later, and it should be, you know, in kind of a consistent location. Staying organized, keeping things in consistent locations can be really helpful. So, you know, having the remote control always stay in the basket on the couch, or you know, keeping the keys always on the keyhole, labeling cupboards and things so you can remember where things are located is always helpful as well. So organizing is definitely helpful for this symptom. Number 8, you might notice decreased or poor judgment. So like I said, intellect is definitely something that does not change. However, judgment can change, and decision-making, weighing options, the ability to identify a scam, and kind of something that might be a little fishy. So some people do fall victim to scams. Some people actually kind of go the other way, where they are a little bit mistrusting. So they think everyone's trying to scam them. My grandfather started to buy these coins online that he thought were going to be like a moneymaker someday, and increase in value. And it was just kind of a scam. And so we had to kind of put the stop to that, because he was buying these coins and not, you know, thinking about the financial cost to him, or, you know, the repercussions of that. So impulsive financial decisions down there as well kind of goes along with that. Poor hygiene, you might notice that they're wearing the same clothes over and over again, or they haven't showered in a few days. So, you know, again, something that is different, and in the same token, their ability to care for themselves, their ability to care for pets. So I told you my grandmother loved Scotties, and she was, oh my gosh, she loves her dogs. And she would always, you know, take them out for walks and to the vet. And when she was starting to have difficulty caring for the dog, she wasn't taking him to get groomed. That was unusual for her. That was a change. And so, again, it was kind of a red flag for the family. You know, we need to get this looked at. Number 9, you might notice that they withdraw from work or social activities. So if they really enjoyed sports, maybe they just cannot follow the game anymore. It's too fast paced, or they don't remember the rules or the teams or the players like they used to. They stop going to church or other activities. Just a general loss of interest in hobbies. And maybe they're sleeping more, so they're not as active as they used to be. Again, my grandparents were very active in the Methodist Church. My grandmother played bridge, and I think that when she kind of started to withdraw from that, it was because she wasn't feeling comfortable going there anymore because of these deficits. And, you know, her garden started to kind of go with all kinds of weeds and things. And so just those hobbies, those things that she did used to enjoy, she's just kind of withdrawing from those. And so on the other side of things, encouraging people to stay active and stay engaged in those hobbies, activities can be very helpful. So my grandfather actually, although he wasn't, you know, running the farms, he still went out there every day, checked on the crops, talked to the worker. You know, he knew who owned what parcel of land all the way up to the end. And so again, I think that helped him quite a bit, and it was something that he loved. Fun fact also, he played clarinet in the municipal band in their town. And he played that all the way up until the very end. Even when he was in a nursing home, he still practiced and played his clarinet and went with my aunt to all the concerts. So again, when I tell you that that long-term memory is preserved, it's so true. And again, just staying active, I think helped, you know, not only his cognition and his thinking, but it helped his mood and his quality of life. So as much as possible, staying active in those things is very good. And finally, you might notice changes in mood or personality. So again, somebody who's normally very easygoing becomes easily upset. Maybe they become fearful or suspicious of other people. Maybe they think people are trying to take advantage of them. Maybe they become more dependent, clingy, or self-absorbed. And a lot of times people can have what we call sundowning, which means their behavior gets worse at night. So a lot of times if you go into a nursing home, you will notice that patients with dementia or Alzheimer's become a little more agitated in the evening. So this is, you know, important to take into consideration, especially, you know, when you're planning things. If you know that it's going to be harder to do things in the late afternoon, early evening, maybe plan a nice breakfast out or do something at a time of day when they're going to be at their best. And then as far as the, you know, personality changes, I think as a family member, it's really important not to take it personally, because it's really not your fault and it's not their fault. It's just, you know, the disease kind of rearing its ugly head. And so counseling can be really helpful for both the person with the disease as well as family, because certainly the psychological components of the disease are great. And so caring for mental health as well as cognitive health, I think is very important. So let's say you've noticed one or more of these signs and the red flag is up and you're very concerned. What do you do now? What path do you take? So I think first and foremost, it's important to start a conversation. Whether it's yourself, whether it's a family member, I think it's important to discuss the things that you've observed and concerns that you have. say it's yourself, you might go to a family member and say, I feel like I'm forgetting things more. I feel like I just can't follow a story. I feel like I'm losing things all the time. Have you noticed the same thing? A lot of times, family, people who know you best are the ones that can provide the best insight. And on the other side, if you are a family member, I think it's important to obviously approach the subject gently, but find a nice, quiet time, place. Again, if morning is best, kind of talking to them then. First and foremost, establishing support and love and saying, I really care about you. I love you. And I'm a little concerned by these things that I'm noticing. Have you noticed the same thing? Now, it's not uncommon for people not to realize in themselves that they're having those things happening. And so I think it is important, again, to kind of get into a neutral third party, which would be the primary care doctor, who could then decide what is truly going on, and maybe let them be the one to kind of discuss these concerns and observations as well, if the person is a little bit resistant to what you're telling them. I think it's very, very important to make a plan early. Even if you're not having any issues with your memory, I think, Alzheimer's is one of those things, the biggest risk factor is age. And after 65, that risk factor increases. Everybody with a brain has the potential to develop dementia or Alzheimer's. And so I think it's very important early on. It's not a pleasant conversation. Nobody enjoys talking about these things, but it's important to sit down with your family and say, in the event that I can't make decisions for myself, this is what I want to have happen. This is who I want to take care of my medicine. This is who I want to take care of my finances, my healthcare power of attorney, my, will, have all of that lined up, because, if things get worse, you don't want to put your family in that situation of having to make those decisions during, a difficult situation. So makes a difficult situation even worse. So having that set out and having a plan is good. Also, a plan for, if you're no longer able to care for them at home, what's plan B? What is that next level of care? Where will they go? And I think that if you're having questions about those things, checking out the Alzheimer's Association website is very helpful. So that is down there on the slide, alz.org. Also, they have a 24/7 helpline, which you can access at any time. If you just have a question, if you have concerns. The chapter here in Kansas City is called the Heart of America chapter, and they are based in Overland Park. So they're close, and they have lots and lots of resources as well. So you can give them a call, and they can give you like region-specific information that might help you with the planning process. Number two, after you've had the discussion, I think it is very important to go in and see the doctor early, discuss those concerns, have it be kind of a third party, a neutral party, talking to the person and, discussing the situation. I think it's very important to have a family member with the person at all appointments, again, so that you can kind of be there as a second set of eyes, a second set of ears, and make sure that you're, both understanding the information together. And just to be there for support, because it's, it's definitely scary. So I think just being present and knowing that you're there, it can make a big difference. When you go to see the doctor, what do you expect? Number one, you definitely need to bring a list of current medications and supplements that person is taking. Sometimes medications have a side effect of confusion. So again, it might be a simple medication change or an interaction that needs to be remedied. Be prepared to talk about medical history. Probably family history. So while age is a #1 risk factor, having a direct family member with the disease does increase your risk, as well as cardiovascular disease. Heart health is very closely linked to brain health. And be prepared for just a normal physical exam. Tests that might be ordered are CT scans, MRIs, scans of the brain. While they cannot diagnose Alzheimer's with those, it can rule out other possible conditions. They also might do some blood work and urine analysis. A lot of times in the nursing homes, when a patient became more confused, that was the first sign that they were getting a urinary tract infection. I like to tell people our body is not different little compartments. It's all together. And I think as we get older, that's even more true. If something's going on wrong in one part of the body, then it can manifest itself in other places, and just kind of gets the whole person out of whack. So, sometimes, confusion and things like that can just be, an infection or something that needs to be addressed, and then the person feels a lot better and their mentation improves. So it's very important to get it checked out to determine what is really causing this to happen. And if, the doctor is suspecting Alzheimer's, you might get referred to see a specialist. So a specialist may include a neurologist, a psychiatrist, a psychologist, a geriatrician, and then you might be able to, come and see me, a speech language pathologist, occupational therapist, or physical therapist to help with some of those symptoms. So physical therapy could help you with balance. Occupational therapy can help you with, daily living activities, self-care. And then I can help with memory strategies and brain exercises and those types of things. So typically a neurologist, a neuropsychologist is going to be the one that actually gives the diagnosis of Alzheimer's. And it used to be that it wasn't diagnosed while the person was living, but now typically I've been seeing doctors making that diagnosis a little bit earlier, which I think can be quite helpful because, again, you need to know what you're up against to be able to plan for it. And so if you get an early, accurate diagnosis, you just have a much better prognosis for maintaining that cognitive function and that quality of life. And then #3, I think it's important to create a plan, an action plan. So obviously, #1, safety is the #1 goal. So decluttering the house, making it so that, there's no fall hazards, unplugging the stove or the microwave or whatever needs to be unplugged if there's a concern for fire. Looking into a personal alert button if there's, a risk of falls or, the person might need help. I think those are definitely worth their weight in gold if that happens. Good lighting, so maybe putting some night lights in the hallway or in the bathroom at night. Keeping commonly used items within easy reach so they're not having to, get up to reach something way up high. If necessary, taking the car keys, because obviously if they're having trouble driving, it's not only putting their life at risk, but it's putting other people's lives at risk as well. So I mentioned my grandfather backing into the light pole, and I think we talked about, it was probably time to be done with driving after that. And he was okay. I think he recognized that it was not safe. And so I think if you kind of put it in that perspective, sometimes that can make it a little easier. And then again, like I said, having that criteria to evaluate when another placement, a higher level of care is indicated to keep the person and caregiver safe. So if it's no longer safe at home, if, at what point do we feel like we need to move to a higher level of care? And that is something that, again, I think some of the resources on the Alzheimer's Association can help with. There's actually a little, questionnaire or thing that you can fill out to find that. So that can be quite helpful. Part of the action plan should be designating, like I said, who is going to be in charge of those daily activities, who's going to be in charge of the medication, the finances, transportation to and from appointments, scheduling appointments, because, you know, it's going to be difficult for the person themselves to keep track of those things. And that's a lot for somebody to keep track of. So, you know, definitely important to reach out for help if you need it as a caregiver, because you're not going to do anyone any good if you don't take care of yourself as well. So, again, Alzheimer's Association has some good resources on helps and supports in this area that are available. I think also I want to finish with, you know, it's not just about surviving with the disease or just, you know, making it through the day-to-day. It's about thriving. You want to have a good quality of life. You want to, you know, enjoy your time with your family. So, you know, there's different things that can be helpful for people depending on their level of comfort and their level of, you know, comfort with medical, you know, professionals as well. So therapy is certainly helpful. We do both restorative and adaptive intervention. So restorative means that we're working on improving brain function through exercises, and adaptive interventions are things like strategies, planning, things to change in the environment, family support, training, to kind of adapt and accommodate for the deficits. Of course, in this time of COVID, there are daily programs normally available, and I'm not sure what is currently happening right now, but Shepherd Center, YMCA, Senior Center, those are usually very, very good opportunities for socialization, activities. Both of my grandparents went to the YMCA daily and swam and stayed active and saw their friends for quite a while. And so I think, again, that can be a great resource. And then we have KU Medical Center, which has the Alzheimer's programming and clinical trials just right here in Kansas City. So there are clinical trial opportunities out there. The Alzheimer's Association has information about Trial Match that will match you with a trial that is available. And they're looking for anyone, normal, healthy individuals, people with the disease, of all age ranges, ethnic backgrounds, you name it. So definitely something to keep in mind. So with that, I wanted to end with some questions, because I'm sure there will be some. And I also just want to thank everyone for their time. And if you have any questions beyond tonight, I will just kind of direct your attention to my email address as well as my phone number down at the bottom. I'd be happy to talk with you personally if there is something else that you don't want to share over the group. So I will take any questions that you have now.
Yes, thank you, Stephanie, so much. That was very, very informative. You can ask questions through the chat or through the question and answer. And I would like to remind everyone that this is being recorded. Stephanie, while we're waiting, I really appreciate your personal touches with your stories of your grandmother and grandfather. I think that it's very good to hear the real life experience.
Right. I mean, like I said, everyone goes through the disease differently, but I think just realizing, you know, what one person's experience was and learning from that can be helpful. And over on the left side there is our family this year. All of the Alzheimer's walks were virtual, but we met at my dad's office and we walked in honor of them. And the flowers there signify, you know, different relationships to the Alzheimer's disease. So yellow signifies that you're a caregiver, purple that you lost someone, and there's a white flower that is symbolic of the first survivor of Alzheimer's. And so my dad was joking that he wanted the white flower And I think that we all agree with that. We just want a cure for this, and hopefully, within our lifetime, we will see that. But until then, I think just being aware of what it is, being proactive, and reducing the stigma that comes with the disease is really important.
I agree. Absolutely. We do have a question.
Okay.
So, how many warning signs would you wait to have before seeking out help?
So I think it depends on the severity. I mean, it can be one warning sign that you see. If it is something that is really impacting their day-to-day life, that would be something that you would want to talk to the doctor about. Because again, it can be something that's very treatable, but it's something that needs to be addressed. And I think, if it is just one thing that you're concerned about, you don't have to mention the fact that you're concerned that it's Alzheimer's, but you could say, I'm concerned about this. Let's go get it checked out to see if there's, an infection or something that's going on. And then if the doctor has more concerns, you can go from there.
Perfect. How or can Alzheimer's occur in younger people?
Absolutely. So it's less common, but there is what we call early onset Alzheimer's, and it can occur in younger individuals. And I think, again, it is just very important to have good communication with your doctor, get your yearly checkups, and so you can really be aware if there are changes happening.
Okay. We have a listener whose husband is exhibiting some signs, but is still quite functional. They see him in a pattern similar to his father that grows worse with time. If addressed, is there a medication that can help?
So that's a really good question. It's probably one of the most common questions that I get. So typically medications that are prescribed for Alzheimer's are things that are going to make the healthy part of your brain work better, but they're not going to help the part that's not working well. So it can't restore brain function, but it can make the healthy parts of the brain better. Also, things like antidepressants, anti-anxiety medicine can help quite a bit as well. So I know my grandmother was taking Aricept, and she was also on an antidepressant medication that helped quite a bit. Typically, people have different responses to the medication. Sometimes it works really well for a while and then it stops working. But, I would argue if you get any kind of good result from it, you should do it. You should take it. If the risks outweigh the benefits. And of course, that's another question for the doctor. The other more common medication with Aricept is also Namenda. Those are the two primary ones that I hear, with my patients that take it most frequently.
Okay. So one participant would like to say that she is sorry to hear about your grandparents. How exactly does Alzheimer's lead up to death?
So it is interesting that, I think that it is the symptoms, and it's almost, the whole disease makes you forget how to do the basic things you need to live. So when when my grandparents were closer to the end, they really stopped eating. A lot of times patients with dementia will just kind of hold food in their mouth because they really don't know what to do with it. Dehydration is obviously a concern because, again, they're probably not going to remember to take a drink of water, so you can offer it to them. So again, I think it's kind of just the body kind of shutting down and forgetting how to do those functions as the plaques and tangles of Alzheimer's kind of take over the brain. The brains are our lifeline, our need to function. Even the things that we do automatically go through the brain. So those automatic things, again, are the things that ultimately will lead to death.
Okay. Are Alzheimer's patients aware that they have Alzheimer's?
Some do. Some are. I think it depends. With my grandfather, he was very aware of it. His brother had it. So I think he went into it knowing that he was maybe at a higher risk. And so when he got the diagnosis, he was still pretty with it. And, he knew. And when he would have problems, he would say, oh, it's that Alzheimer's again. So he was aware. My grandmother did not have any history of it in her family. She got diagnosed with it first, actually, and hers progressed a lot faster. And so I think by the time the diagnosis was given and they knew what was going on, she was kind of beyond the point of understanding. So it depends on when the diagnosis is given and their background knowledge of the disease itself.
Okay. More of a comment for you, but thank you so much, Stephanie. You did an excellent job, and it was a lovely presentation.
Thank you. I do this, and I think that, I do this and I feel so passionately about this because, it is personal, and I hope that I'm making my grandparents proud by sharing their story and hopefully helping other people. So that's my main goal. So I just want to help people. So.
Absolutely. Well, I know you helped me, so this is definitely something that's dear to my heart too. So I appreciate it. So I will go ahead and end. It doesn't look like we have any more questions, but if you guys do have questions, you know how to find us. So again, thank you, Stephanie. That was absolutely wonderful. And if you have any questions, again, you know where to find us. I will be sending everyone out a link for this. It will be posted on YouTube as well. So thank you, everyone, and have a good evening.
Thanks, everyone.